General anesthesia can be broken down into three distinct timeframes, and the first one of which is a pre-anesthetic period. This period usually occurs before the administration of an anesthetic, which is done 15 to 45 minutes before the general anesthesia in the animals. The following are the goals of the pre-anesthetic period. First, to reduce or eliminate pain. Second, to assist in calming fears. Third, to make the animals easier to handle. It also aims to minimize undesirable reflex autonomic nervous system activity, the vagal nerve, salivary and bronchial secretions, arrhythmic, and arterial blood pressure alterations. Aside from that, one of its main goals is to supplement general anesthesia. That is done by adding a level of analgesia or sedation and by reducing anesthetic requirement. Pre-anesthetic period also minimizes undesirable post-anesthetic recovery complications, prevent infection, and lastly, continue treatment of the intercurrent disease. However, there are also complications associated with pre-anesthetic medication. The first one of those is depressed vital organ function, second, anti-analgesia, and lastly, the prolonged sedation or prolonged recumbency or ataxia. The following are the seven major classes of drugs for pre-anesthetic medication. These are the tranquilizer sedative, hypnotic sedative, opioid, alpha-2 adrenergic agonist, dissociative, combinations, and the parasympatholytic drugs. First of the seven classes of drugs is the tranquilizer sedative. It acts by slowing down certain body functions or the activity of an organ. Drugs under this classification include the phenothiazine, butyrophenone, and the benzodiazepine. The second classification of drugs, in which the barbiturates and the chloral hydrate belongs to, is the hypnotic sedative. Its main function is to reduce tension and anxiety and induce calm, its sedative effect, or to induce sleep, its hypnotic effect. The adverse effects associated when administering this type of drugs include CNS depression, sedation, sleep, coma, and death. Next are the alpha-2 adrenergic drugs. So these drugs facilitate dose-related sedation, and analgesia is commonly used singly or in combination with opioids and dissociative agents. Drugs from this class are the xylazine, litomidine, and medetomidine. Its unusual side effects, on the other hand, are the bradycardia, mild arterial hypertension, prolonged hypotension, hyperglycemia, and increased urine volume. Another drug classifications are the opioids that act on opioid receptors to produce morphine-like effects. Medically, they are primarily used for pain relief, including anesthesia. Notable examples of these drugs are the morphine, meperidine, and butorphanol. However, administration of opioids can cause hypoventilation, vagotonic or decreased heart rate, central nervous system arousal in horse, unwanted vomission, decreased intestinal propulsive, and ruminal activity. Moving on, we also have the dissociative class of drugs. Ketamine, phencyclidine, and methamphetamine belong to this group, and they provide a state of somatic analgesia and sedation. But they can also cause CNS arousal in horse and animal excitement or frank convulsion. The sixth one are the combinations. They provide ready access to clinical benefits of two drugs while attempting to minimize their individual disadvantages. Examples of combination drugs are the tandems of enobarfentanyl and telazol pilitamine. The last of the seven classes are the parasympatholytic drugs. Their main function is to reduce upper airway and salivary secretions and counteract reflex bradycardia occurring with concurrent opioid use or ocular surgery. examples of which include atropine and glycopyrrolate. Unwanted side effects are tachycardia, reduced gastrointestinal motility, and mydriasis.